Okay, it will soon be 5 minutes, I think. Okay. We can start now. It's 5 minutes. Hello, everyone. If you can hear me, can you just unmute your mic and just respond?
Good morning.
Yeah, good morning. Good afternoon.
Good afternoon.
Yeah, good afternoon. Okay, so thank you all for joining in. This is PSN-YPG. This is organized by the Northeast with the help of the project committee, and the committee leader is here with us this afternoon. I'm going to give her some few minutes to introduce herself and tell us one or two things, just a few minutes before I introduce our speaker for today. Okay, Miss Jongbo, over to you. Jongbo.
Hi, good afternoon, everyone. I hope you can all hear and see me. My name is...
Yes, you can.
Okay, thank you. It's good to be here today. My name is Jongbo Olubukola. I'm the coordinator for the Professional Development Committee, YPG National. And I'm just here to briefly say welcome to everyone who has made our time to be a part of this. Thank you. And I'll also just want to remind us that there are several other opportunities like these other events that the committee will be bringing up. We should try to look out for them and be a part of it. We're also making plans for some other physical events and trainings for young pharmacists all over Nigeria. Let's try to look out for this information on our state YPG pages and the Telegram, National Telegram page. So if you're not on the National Telegram page or channel, do endeavor to be a part of it. You can reach out to the zonal coordinator or your YPG state coordinator for the link, and it's been made available to you. Also, we have events on this Telegram page. We have some mini trainings on the Telegram page, and the next one will be coming up on the 15th of this month. So if you want to be a part of that, you don't want to miss out, I'm very sure you don't want to, as much as possible, to join the Telegram group. Yes, and the channel, try as much as possible to join in. So once again, thank you for being a part of this. I know you're going to enjoy this. Yeah, thank you.
Thank you. Thank you. That's the chairman of the committee that just introduced everything, and there's going to be some more webinars for other regions, and people from this region can also join. The aim is to, this webinar was specifically designed for the Northeast, but is open to every pharmacist in the country, and everyone can join in and be part of this as well. Okay, so I am Murma Hassan. I'm the coordinator, Northeast Zonal Coordinator for YPG. And today we have in our midst our host, our speaker, who is from Khalid Garba Mohammed. Let me just give a brief introduction about him. Some of us might have heard about him or know him. He graduated from Ahmadu Bello University Zaria, where he obtained his BPharm and his MSc as well. He did his MSc in pharmaceutics. He's currently rounding up his PhD program in applied pharmaceutical technology at the University of Milan in Italy. He has been an active leader throughout his university days. I remember him, he served as the president of PANS that time. When I think I was in 100 level or so when he was the president. And after that, he still continues his leadership positions. He's in the FIP and a lot of other places, ABU alumni and a lot. And he's into research and some other things like that. So I'm going to call him up now so that he continues for us. You're welcome, sir. You can take the stage now.
Thank you, Murma, for the kind introduction. I hope you can hear me all.
Yes, I can hear you.
Okay, so thank you for the kind introduction, and I do welcome all for participating at today's webinar. A little point of maybe not correction, but information. You mentioned, Murma, that I'm rounding up my PhD. Actually, I have rounded up my PhD since January, just finished in January. So first of all, let me extend my special gratitude to the organizers for the invitation. Also at the same time, must say sorry or apology for, I know we have been postponing the program for a while, but finally here we are. So thank you for the kind invitation. And I do hope at the end of the day, at least even if it is one key message we take home, we can all benefit from this discussion today. So the topic is navigating career trends in pharmacy practice. I didn't make an outline, but briefly, I will talk about the paradigms in the pharmacy profession itself. And then from there, we will look at some shifts in the professional practice, not only in Nigerian context, but on a global scale. And please feel free to either use the Q&A box to send your questions, so that we can entertain them at the end of the session. So first of all, the evolution of pharmacy practice. If we are all conversant with, there is a course, I think, in pharmacy schools, depending on which pharmacy school we attend. we attended that is dealing with specifically an aspect of history of pharmacy. So when we look back at the history, we can see how the pharmacy profession evolved from mere apothecary model to a modern day clinical pharmacy, or we can call it pharmaceutical care model. So back in the olden days, up to like around 20th century, the beginning of the 20th century, still the apothecary model was what is being practiced. Then even pharmacists per se, they don't have the so-called qualification as a pharmacist, but you have different type of maybe qualification even at the practice level, chemist and druggist diploma and so on. So essentially in this era, pharmacists, the so-called pharmacists, if I may use the term, we are using recipes models. You have a recipe, for instance, like what we have now in our traditional medicine, usually context. You have a recipe, you know, if you mix this and this and that, either you make a concoction, either you put it in the cold water for some time, either you heat it at a particular maybe type of heating, you will obtain something that when you use, it will be able to treat a particular disease. And it is in this context that some apothecaries, they can even prepare the mixtures, tinctures, for several purposes, and they can either directly administer to the patient or send to client for honor administration to the patient. So in around 1945, the compounding model started to emerge. The compounding model essentially here was a kind of an industrial revolution in the pharmacy practice. Why? Because that by that time there was some sort of introduction of industrial scale manufacture, preparation of pharmaceutical products. Then the pharmacists usually in real practice, what they do is they either use the medication that is available as manufactured by the pharmaceutical industry to the administer to the patient, or compound it on the basis of the patient needs. That is around the 1945. And when you move further, the distribution model, that is another industrial revolution era, where you have large pharmaceutical manufacturing of the medicines, and then the distribution of the same across the globe, not only per country, but across the globe. And then toward the early of 1960s, that you have the complete evolution of the pharmaceutical care or clinical pharmacy. And as we all know, this is more of the patient-centered care, because in all the previous eras, you are more of concern more of the drug itself. How do you formulate it? How to administer it to the patient? But in the clinical era and pharmaceutical care model era, there was this more concern toward orienting the pharmacists per se into, okay, both the drug aspect and also as well as the patient aspect. What are the ways or modalities to follow so as to obtain the maximum therapeutic benefits of the drug? So in brief, this is about the evolution of the practice. And when we look at the generic roles of the pharmacists, we will say that, yes, it is more of the product focus. Why? Because it is usually centered towards utilizing the medicine, where you have a manufacturing and supply system of the medication, as well as some essential information that are really related to the drug itself. But issue regarding the patient is not a priority in those era. And you will have pharmacists in those era essentially dealing with serving as educators, managers, or mentors, as the case may be. Here you can call it, you can serve as superintendent pharmacist, so you mentor the junior one. They also serve as business service developers in the cases of supply chain of the medicine or marketing strategy for the pharmaceuticals, leaders or researchers. But as the 21st century emerged, the roles of the pharmacists changed, or is still continued to change, because the 21st century pharmacist is essentially committed to people-centered care. Why I say people-centered care here, I didn't mention patient-centered care, is because in the 21st century, pharmacists are expected to deal with public health issues, not only dealing with the patient, but also public health. And when we say public health, we are not talking only about patients. We are even talking about people that are healthy. How do they maximize their healthy lifestyle? What do they need to do in order to improve their healthy lifestyle and to improve their quality of life? So pharmacists are very much engaged in that regard in the 21st century. And all in all is to ensure high quality use of medication. And at the same time, this encompasses the effective, safe, and appropriate use of medicine by the patient. And additional roles in this 21st century undertaken by the pharmacist largely depends on the location where the pharmacist is practicing. For instance, for the pharmacist practicing in the United States of America, some of the paradigm changes or shifts that has happened there is completely or entirely different from what paradigm changes we are experiencing here, for instance, in Africa or in Nigeria, as the case may be. So the competencies depends, or the changes that you need to adapt or to adjust in order to suit the specific purpose for your service delivery depend on your location of practice, the experience, the competencies that you acquire over time, and also the interests and many other factors. So it is important to note that in this ever-evolving era for pharmacist's role, we must be able to be part of the decision makers and also acquire necessary leadership in order to be important or relevant in the profession and beyond. And we must also adapt to develop our own practice and roles, all in order to meet the ever-increasing change of needs by our clients, the patients, and the caregivers. And also we must be flexible to navigate multidisciplinary approach in the sense that a pharmacist practicing in the academia can have some interpersonal or interprofessional relationship with the one working in the hospital and community. Why? Because a pharmacist working in the hospital may have a much know-how of what the patient needs. And then those in the academia that are involved in research and development, they can link and collaborate. Okay, what does this particular type of patient need? How do you as a researcher develop something that can solve a particular problem related to this particular patient? So all these are interdisciplinary in nature. The current trends in the pharmacy practice, you can all believe with me that we have evolving changes in the practice. For instance, when you're talking about innovations, you're talking about meeting the patient needs, and you're talking about integrated healthcare system or integrated healthcare models and new roles that are continued to emerge for the pharmacists. For specific example, in terms of innovation, you have issues related to health information technologies. There are many hospitals, not only in the developed world, but now even in the developing countries, for instance, that are using health information technology in terms of making available data from the entire hospital, where you have a direct link between the clinicians and the pharmacists. The clinician will see the patients. You have a health information system or a platform, pharmacy softwares, that the information of the patient can be shared digitally between the physician and the pharmacist. All these are evolving innovations which are not existing before. We are talking about digital health. You can use digital health to monitor even the therapeutic, to use it for therapeutic monitoring of your medication. How is the patient taking the drug? Is he consistent? Are there potential problems that you need to intervene with time? So all this digital technology can intervene and bring about positive changes in the profession itself. And we're talking about also robotic dispensing systems. Robotic dispensing systems are being utilized in many developed countries that reduce the time consuming during the dispensing procedure to the patient and will improve efficiency in pharmaceutical service provided. And you're talking of automation in pharmaceutical industries. All these are emerging technologies that are becoming part and parcel of the pharmacy profession itself. And when you're talking about meeting the patient needs, some patients require some special attention in terms of medication. For instance, we are talking about personalized medicine, in the sense that sometimes you need to study the genetic factors of the patients in order to understand what specific medication they need. So pharmacists are becoming part and parcel of this ever-evolving era. You also have some personalized dosing when you're talking about pharmaceutical technology here, where you need to develop probably child-appropriate dosage forms, or you need to develop dosage forms that are more appropriate for geriatric patients, so as to, in order to meet one-on-one care or demands of pharmaceutical services. So all these are evolving, and they are becoming part and parcel of pharmacy practice. And when you talk about the integrated part of the health system, for instance, health insurance companies, pharmacies, community pharmacies, hospital pharmacies now are becoming integrated first part of health insurance companies, and as well as government health insurance schemes. For instance, in many countries like in the US, Europe, you'll see that both their hospital and community pharmacies are becoming integrated into their health insurance schemes. Wherever the patient assesses a physician, they can be able to obtain their drugs either within the hospital or within the community as part of the integrated healthcare system of the nation. And when you talk about new roles of the pharmacists, for instance, we are talking about vaccine administration. You will all believe with me, even the COVID-19 has exposed so many lacunas in the terms of pharmacy practice between country and country. For instance, some countries now, the pharmacists are able to administer vaccine, not only COVID vaccine, but other adult vaccines, a lot, and children vaccines, immunization process. They are actively involved in countries, many countries in Europe, US, and even in some Arab countries. Pharmacists are now actively engaged in basic healthcare services, such as diagnosis of some common ailments, diabetic, malaria, rapid diagnostics testing, pregnancy testing, family planning counseling. And they also serve in mediation therapy management. Mediation therapy management is a system whereby a pharmacist, either in the community setting or in the hospital pharmacy setting, provide mediation between the patients and the clinicians, because they are the expert in drugs. So therefore, they can assess prescription for the patient, evaluate their clinical condition, whether there are any other side situation that may not warrant the patient to utilize a particular prescription given to the patient by the clinician. So they intervene through mediation. Mediation in the sense that they provide relevant information so that the clinician and the patient can make an informed decision based on the relevant information provided by the pharmacist. So you can see the paradigm is a complex but very synergistic in nature. For instance, when you're talking about personalized medicine, for instance, why pharmacists' role is very critical there. If we consider the WHO initiative in 2010, which introduced what is called better medicines for children, there were several observations. For instance, it was observed that fewer medicines are available in smaller doses, which implies that about 48 to 54% children medicine are unlicensed or off-level, meaning that their use are off-level or unlicensed. That in some cases you have a medicine which is licensed or registered for use in adults, for instance, in tablet form or in capsule form. But because a child needs the same medication, but commercially it's not available in the tablet or in the suitable dosage form for the children to administer. So you see that the pharmacists are engaged in maybe extemporaneous compounding of that medicine to suit the purpose of the children. But here comes some issues related to, for instance, stability problems, which can result as from either physical, chemical, or microbiological problems, instability problems. You will also have some palatability problems in medicine for children. For instance, when you compound an oral medication, probably tablet, which is meant for adults, into a pediatric maybe suspension, you may not have the know-how at the extemporaneous preparation level of how to mask a particular unpleasant tests of the medication. So it's a problem. So therefore, the WHO think that this issue must be addressed. Another issue is related to, for instance, essential medicine lists, which did not account, for instance, for some special formulations such as like oral dispersible tablet or oral dispersible films. And then also fixed dose combination. Back before 2010, there were less attention to fixed dose combinations specifically for children. And some of the global bodies like European Medicine Agency in the Europe, in 2007, they issues what they call EMA requirements for safety, quality, and efficacy of medicinal children before they can use in children. So it's not all medicine that you have a tablet form of it for adults that you just come and compound and make it suitable for children. It's not always a solution to obtain their medication. So therefore, innovations that are emerging in the field of pharmaceutical manufacturing or dosage form design and personalized medicine can address some of these related issues. So you can see this is also an evolving form of the career trend. You have to understand the patient, you have to understand their needs, and then when you go, this is a clinical aspect, and then when you go to the science part of it, the technological part of it, in terms of the career, then you have to understand, okay, what are the needs of the patient? So how can I develop a dosage form that can address those needs of the patient? And it is in this same vein that the International Pharmaceutical Federation developed what is called FIP development goals in 2020, that last year, which try to actually harmonize science, practice, and pharmaceutical education and workforce, all in order to transform the pharmacy profession. Transformation of pharmacy profession to meet all the needs of the patients and the general public cannot achieve without these three key components. That is the practice of it, what needs to evolve in terms of pharmacy practice, what needs to evolve in terms of the science. The science is here, I'm talking about, okay, in terms of pharmaceutical practice, what are the needs of the patients? And then how do we address the needs of the patient? That is, you have to link up now with the science. You have to link up with the people in the academia. You have to link up with the people in the research and development in the industry. And then what are the pharmaceutical workforce needs of a particular country or a particular region or of a particular specialty? That is where the pharmaceutical workforce and education comes in. You need to educate to produce a efficient number of the pharmacists that will address the workforce deficiencies in some areas. So that's what the essence of developing this, the FFP development goal, and its essence is to achieve most of the goals by 2030. What are these goals? There are about 21 goals that were developed. The first is academic capacity. It is through academic capacity that you will build the capacity, you provide the necessary pharmaceutical workforce. Earlier career training and strategy, for instance, now the FIP-YPG, and also the PSN-YPG. What do we need probably as elder pharmacists to provide to the early career pharmacists? What training do they need? What skills do they need to acquire? Quality assurance, how do we evaluate quality assurance? Are the pharmacy education having the necessary quality for the student to understand, for them to graduate and practice? So there are about 21. Why I'm trying to bring about this is to help us understand how the profession is evolving, or how organizations like the International Pharmaceutical Federation is serving as a yardstick or as a bridge between, like, a forecast of what the profession will look like or what the people will need in the future. And then how do we stimulate the pharmacists in order to continue to meet off the needs or the ever-increasing needs of the clients in the profession. So this brings me to the current trends or the career trends in the pharmacy practice itself. I was able to gather about 9. Yes, depending on the country or region where the pharmacist is practicing, this list can be enumerated beyond this. It can be lower or it can be higher. But on an average scale, on a divergent scale, these are the 9. First is the community practice. Yes, there are many paradigms or different career in the community aspect. But what do the pharmacists in the community pharmacy practice need to do in order to meet of the ever-increasing needs in their sector, for instance? In the academia, what do the pharmacists practicing in the academia need to do in order to meet the ever-increasing demand? What are the trends going on? In terms of hospital practice, are there some changes from the 1920s to date? Are there some things that need to evolve, or are there some things that the pharmacists need to embrace in order to meet up the ever-increasing demand? What about the aspect of administrative and regulatory pharmacy practice? Industry, pharmacists working in the industry, what are the different portfolios they have? And what are the necessary competencies they need to have? The military and paramilitary pharmacy practice, for instance, who are working there as a pharmacist and what are their key roles and responsibilities? And then when you talk about intergovernmental organizations, are pharmacists needed there? Yes, of course, they are needed there. They are needed in places like the United Nations volunteers. There are a lot of volunteer services or programs. In the WHO, yes, pharmacists do have an active role or are playing an active role in the World Health Organization, the UNICEF, the UNESCO, and many other intergovernmental organizations. What about the non-governmental organizations? Do the pharmacists have roles to play there? Or do they have some paradigms that they need to adjust in order to meet the ever-increasing needs in that era? Yes, pharmacists do practice in the non-governmental organization as consultants, specialists in the aspect of drug procurement and supply chain management system. Are pharmacists working in professional organizations such as FIP? Yes, they do. But what are the roles and responsibilities of pharmacists in those organizations? So in essence, these are what I intend us to also look into, and briefly we'll go through them. For the community pharmacy, what are the evolving roles of pharmacists there? The evolving roles, obviously, as some of us know, or we might even be practicing elsewhere, not only as Nigerian pharmacists, we know there is an aspect of telepharmacy that is going on, where you need to make probably teleconference, you need to make phone calls in order to discuss with the patient, to understand their needs and to address their needs, even as a community pharmacist. There is aspect of mail order where maybe client can now just by a click can order for their medication. We know that we have over-the-counter medication and even some prescription drugs that in some countries are well regulated, are well linked, so that the community pharmacists have the information of the patients, their location, and you know when their prescription is due for refill, and they can make transaction in order to refill their medication without the patient being necessarily coming to the pharmacy, community pharmacy practice. There's this issue of vaccine administration. As I mentioned at the beginning, the COVID-19 has exposed a lot of lapses in some pharmacy practice in some countries and in some regions. In Nigeria, for instance, we are still struggling in that perspective. Pharmacists are not allowed to vaccinate, which is still a matter of debate. But in some countries, they have passed this for long. They are not only administering, for instance, nowadays, COVID-19 vaccine, but they are actively engaged in other vaccination for adults and children, flu vaccine, influenza vaccine, and so on. Interestingly, yesterday I was checking through Twitter and I found it through FIP Twitter that the Ministry of Health in Jordan have authorized the pharmacists there to immunize, following the work of what? Immunizers of Pharmacists Project. It's a task force. So if Nigerians want to emulate something like this, or want to have the Nigerian pharmacists, especially those practicing in the community, want to have something like this, yes, it's not just a day job. You have to start something. You need to actively engage in advocacy and mobilization. You need to reach out to the stakeholders, voice out, and showcase your relevance in that particular aspect. We also have evolving roles in the community for pharmacists as basic healthcare service providers. As I mentioned, they do provide services such as rapid diagnostic testing for so many diseases like diabetes, rapid diagnostic testing for malaria, pregnancy testing, family planning counseling, and so on. Pharmacists in many countries are actively engaged in smoking cessation programs and initiatives, and they do provide essential services. Acknowledgement of their services in that aspect has been given in so many countries like Australia, Netherlands, United Kingdom. They are actively part and parcel of smoking cessation programs. They also do act in mediation therapy management, as I mentioned earlier, what mediation therapy management is all about. What are the recommended skills that community pharmacists need to acquire in order to meet the ever-evolving roles in their aspect or in their area of practice? You're talking about fellowship or residency. Yes, they are somehow similar words, but interchangeably depending on the country or region where you are practicing. This will develop your specialty. For instance, you can have a specific specialty even in the community. Then you need to acquire some advanced courses in clinical pharmacy so as to understand more what pharmaceutical care is all about so that you can implement in your community pharmacy. And believe me, by practicing those, you will be able to distinguish yourself from others. You need to also acquire some skills in strategic management and business skills. These are very important. When you talk about academia, are there some paradigms? Yes, but what are the recommended skills that you need to acquire in order to meet the paradigms or the changes happening in the academic pharmacy practice? Of course, you must have good communication skills and human psychology. You must understand your student very well. It's not all about just getting into class and teaching. You need to understand the psychology so that you know how to effectively communicate with the students and also even try and address some of their problems, both personal and the academic problems. You must have the knowledge or know-how of how to teach online. We have seen how the disruption of the COVID-19 actually brought about several interruptions in our communication, teaching processes. Believe me, in many countries in the advanced world, there was not much interruption in terms of their pharmacy education. Why? Because they embraced the teaching online programs. But what happened in developing nations, countries like Nigeria, for instance, there were a complete shutdown of schools. Yet, in some countries, nothing stopped. The online teaching continued. And if you are not conversant enough with the online teaching strategy, you will not cope. That's what's the main reason why some of the universities were shut down in African or in developing countries. When I'm talking about developing countries, I'm not only about Nigeria, South Africa, or Africa. I'm talking about some countries in the Asia, some countries in the Arab regions. So an academic pharmacist must be acquainted with the innovative research. You must be able to carry out innovative research so that the research will be translational. It is through the translational research that you will have to understand the role of patents. How do you patent your technology when you have an innovation and you develop it? How do you protect it? Then the knowledge of patent now comes in. How do you apply the patent and how do you benefit from the patent? Because the patent is like a protection. You have developed something which is very important. It is your own intellectual property. Then how do you protect it so that you benefit maximally from it with time? So you can apply and you can be given some specific time, let's say 5 years, 10 years, depending on the country regulation on patent. You can enjoy the patent, the exclusive right for that particular patent or technology you developed. And you must have the skills for industrial collaboration. It is only through meaningful research that you will be able to link up what you have studied in your lab and how you translate it into large-scale production. And now you are talking about technology transfer. Now you are talking about money. Now you are talking about finances. So you can be able to link up and actually develop yourself and develop your institution. Because when you translate your research into real large-scale production, you improve the income of yourself and you improve the income of your institution. Because this is why the patent is there. You must also have some collaboration with non-governmental organizations, for instance, and other institutions. Sometimes you need to do collaborative research with some researchers from other institutions. Not only within your country, probably you need to send some sample or you need to go abroad or outside your own comfort zone in order to maybe study something in another institution. So you must be able to have these networking skills. Working with NGO as an academic I think, should be an essential part of you as a pharmacist. You may have some non-governmental organizations that may come to your country with some essential programs, health promotion programs. So they may take you to serve as a resource person. But if you don't have the required competencies, communication skills, good presentation skills, you may be lagging behind. You must also be able to participate in professional organizations such as FIP, as the case may be. Depending on your country, you may have Association of Pharmacists in Academia, you may have Pharmaceutical Society of Nigeria, for instance. So you must be able to actually participate in those professional organizations. It is because it is true that you'll be able to understand the changes of the profession in either your country or even at the global scale, so that you can be able to either educate yourself or even downwards educate others. Now let's briefly look at the hospital pharmacy practice as a career. Apart from the trivial workflow we know in the hospital pharmacy practice of drug procurement, distribution, storage, and so on, there are evolving areas which, believe me, in many advanced countries, these are no longer even evolving. They have been part of and puzzle of the hospital pharmacy practice, like nuclear pharmacy, pharmacies that will study, okay, what are the radiation components that are used in medical, not only for treating cancer, but also for diagnostic purposes. Oncology pharmacies. There are pharmacies that are now specializing in oncology. I'm happy in Nigeria, we are having this, is evolving. In many hospitals, teaching hospitals, we have pharmacies that are dedicated and trained on oncology so that they understand the aspect of cancer treatment. What are the drugs that are mostly used in cancer treatment? On what type of cancer do we need to use this particular drug? What are the possible side effects? What are the things that you need to do? I mean, the pre-exposure. Do you need to give some antiemetics to the patient? What are the possible side effects? How do you monitor a particular patient on cancer treatment? What are the signs? So all these are essential part and puzzle of the paradigms in the hospital pharmacy practice. Now, I'm glad in Nigeria, a lot of institutions are embracing that. You have issue of solid organ transplant. Some pharmacists are specializing in that aspect. Cardiovascular diseases, some pharmacists essentially specialize in cardiovascular disease. They have the know-how of all the drugs that are used in the cardiovascular disease, either their utilization in the adults, in the pediatrics, and so on. So all this, we are talking about specialty and ambulatory pharmacy practice, where pharmacists need to engage in ambulatory settings where the patient may not necessarily need to come to the hospital. For some reason, you either treat them while on transit or so on. So pharmacists are engaged in all these aspects and ramification, but how do you make yourself relevant in order to meet these evolving changes? You must take specialty courses or fellowship. Thank God now that in Nigeria, I read it recently, the Ministry of Health have now recognized the consultancy cadre for pharmacists, which is a good development. And this particular aspect has been in existence for decades in many developed countries. But still, thank God we are not lagging behind. At least this is coming up. So the question is, how do we make yourself relevant in order to meet this important aspect in hospital practice? You need to take some fellowship or residency, as the case may be in the country. Obviously, the West African Postgraduate College of Pharmacy program is there, depending on where you are practicing, of course. And you also need some advanced courses in clinical pharmacy practice so as to make yourself relevant in this career aspect. When you talk about administrative and regulatory pharmacy, even though in some cases you may hear them calling it social and regulatory or social and administrative pharmacy practice, typical setting where people work in this include federal and state ministry of health, where pharmacists can serve as directors or deputy directors. For instance, in Nigeria, you have Pharmacists Council of Nigeria, where pharmacists practice there as regulatory, as well as administrators. You have NAFDAC, National Food and Drug. You have also FDA in the United States, for instance, in the United States of America. You have the National Drug Law Enforcement Agency, NDLEA, where all pharmacists can work there. They provide regulatory and administrative responsibilities. Are there changes in those aspects? Yes, there are emergent changes. For instance, at some point in time, you hear a lot of drug trafficking from one country to another. But what competency do you need in order to work effectively and efficiently in those aspects? You need international collaboration, of course, either as individual or as a body. Maybe you are working with the NAFDAC or with NDLEA. You have to have, your organization must develop some collaboration with international bodies that have similar responsibilities like them. So you can as well have individually develop yourself to collaborate with others in similar field in other countries. You may need some research experience. For instance, for pharmacists working in the NAFDAC, you need some research experience. Why? Because you will engage with evaluation of the quality of some products. So you need research experience. Probably you need to evaluate the drug on the basis of their dissolution properties, their chemical constraint. So you must have some pharmaceutical research ideas or experience. You may also need to have some advanced courses on international relations and international drug laws, because it is when you understand what is happening as far as drug laws with respect to other countries, that is how you can also harmonize and harness to efficiently discharge your responsibility in your own domain. When we talk about industrial pharmacy as a career, are there paradigms? Yes, there are a lot of paradigms in that aspect. Because now we are talking about in silico drug development. We are talking about artificial intelligence. We're talking about you, before developing a drug, you have to do some dry lab experiments. You don't need to go to the lab and experimental this drug and screen. No, you need high throughput screening technologies where you sit on your computer, you spend months screening and evaluating, docking and undocking, molecular evaluation. All this will help reduce the costs in production and reduce the workforce needed for drug discovery. So what are the recommended competencies or skills that you need to acquire in order to meet the ever-increasing paradigms in the pharmaceutical industry? If you want to practice there as a career, you need to have some pharmaceutical research experience. That is especially for those that are going to work in research and development, because there are different portfolios in the pharmaceutical industry setting where pharmacists can work. They can work in the research and development. They can work in the marketing strategy or sales and marketing strategy department. They can work in the quality control and quality assurance department. So there are so many portfolios where pharmacists can work in the pharmaceutical industry. So you need to acquire the necessary skills depending on the portfolio in which you will serve. So you need to have the in silico drug design and artificial intelligence knowledge so as to meet off, depending if you want to practice or in the hospital, specifically in the research and development department. You need to have some project and data management skills. If you are to deal as a pharmaceutical industry, there are some points where you need to deal with regulatory bodies. So you need to have the appropriate knowledge on regulatory affairs. Okay, you are developing drugs for use transdermally. What are the rules and regulations governing the development of drug in that aspect that will help you for the drug to reach up to the pharmaceutical market? So you need to get acquainted. Are there specific regulatory requirements? What are they? You need to get acquainted with it. If you are in the sales and marketing strategy department, you need to understand some sales and marketing strategies. For this, you may need to acquire some additional qualification, probably in business administration. You may need to acquire some fellowship programs, either through university or some institution, or even fellowship in the pharmaceutical industry itself. Or at some point, some industry, for instance, in Europe, for you to practice in the industry, essentially, mostly they need pharmacists with PhD. So you need to understand all this so that when you have a particular desire for a particular career, you know the competencies that you need to meet off in order to be there in a particular career you want. For the military and paramilitary pharmacy practice, for instance, in Nigeria specifically, pharmacists can work or are still working in military and paramilitaries like in the Air Force, Navy, Nigerian Immigration Services, and even the Nigerian police do employ pharmacists. What role do they serve there? Essentially, they serve the ensured appropriate supply chain of drugs and medical consumables, prescription filling, dispensing, compounding, and as well as pharmaceutical care and other responsibilities that are keen to hospital pharmacy practice. That is in addition to their military responsibilities. Of course, they need to acquire some essential skills. Obviously, the military and paramilitary training, depending on which of the sector you are. Conflict resolution strategies. Obviously, these are some advanced courses that you may take either personally or through your organization. Dedicated to United Nations volunteers, where you can register as a pharmacist, you can register and list all your experience and your relevant portfolios, but whereby when they need volunteers, they will just search your relevant profiles. And if your qualification and experience match their needs, they can pick you and invite you to serve either locally or internationally. So I implore you to check UN volunteers. If you have time, register. You will see different portfolios and different area where you can be engaged to serve as volunteers. Not when I say volunteer here, it's not really the voluntary work, but you will be paid some a remuneration, of course. We're talking about WHO, World Health Organization, UNICEF, UNESCO. We are talking about Global Fund. All these are intergovernmental organizations. For instance, Global Fund is responsible for managing funds that are used for global prevention of diseases. Essentially, these three diseases: malaria, TB, and HIV/AIDS. So they work with governments internationally and intergovernmentally, even though they may engage some third party at some point in time, but pharmacists do work with them like at different region, at different part of the world. Antimicrobial stewardship. What do we need to do as a global in order to prevent antimicrobial resistance, in order to improve rational use of antimicrobial agents? Because there is this ever-increasing problem associated with antimicrobial resistance due to antibiotic resistance and antibiotic abuse. So you need to develop some competencies on how to advocate on these problems to ensure antimicrobial stewardship, their effective and rational use. We are talking about you to have some skills on evidence-based research. Evidence-based research here, I'm talking about aspect of epidemiology, pharmacoeconomics, pharmacoepidemiology. So you need to develop yourself in those regards. You also need to develop yourself in drug procurement and supply chain management. Global health policies, there are several courses on global health policies where you will see different models of global health, different models of global health, different models of how effective policies are helping in shaping the healthcare system in a particular country. You can study models of healthcare delivery system in Japan, in US, in UK, in Africa, so that you can compare and contrast which models best suit a particular purpose. So you need to develop yourself in those regards. We are talking of UNESCO, for instance. Therefore, UNESCO has a lot to do with education, partnership, ensuring partnership in education between maybe developed and developing countries, universities. How do we link up collaboration so as to improve capacity or move capacity? Here you need to engage professors, for instance, university professors from the two regions, probably from the advanced and developing countries. Those engagements have team spirit, teamwork spirit. They must be able to work in multidisciplinary team. So this is an aspect that has to do with the pharmacists that can be engaged in intergovernmental organizations. And then when we talk about intergovernmental organizations, for instance, obviously when you hear the name FIF, it is obviously for pharmacists, International Pharmaceutical Federation. When you see partnership with WHO, obviously WHO is
Hello, I think there's a little network problem. Can you guys hear me?
Yes, we can.
I think it's from the.
Yes, we can hear you.
It's from the facilitator. I think maybe there was a problem with his network because He just notified me that he has left the meeting. Please, can we just give some few, like just a minute or two? He will just come around up, then we have the session of question and answers. Just some few minutes, please. Let me chat him up and see. We're still here, sorry. We're waiting for the facilitator. I think he had network issues. So just before he comes back, he was talking about the career trend. I think he's on the last one, professional organizations. That's the 9th one. He talked about, just a recap of the 9 trends. He talked about community, academia, hospital pharmacy practice, administrative and regulatory, industry, that's marketing and sales representative for pharma industries and company, then military and paramilitary pharmacy practice, intergovernmental organizations, UN, WHO and the rest, NGOs as drug supply chain logistics, experts or consultants, and the last one he's on now, professional organizations. So let's just give him some few minutes. By the time he's 1, if he's not back, I'll just open the floor for questions and answers. If, well, a lot of us have been here from the beginning of the meeting. So if I can't answer, someone else might be able to answer, or we would forward the question to our facilitator and we'll get an answer from him. Oh, he's saying he can't connect again. Oops. Okay. Well, he's saying he can't connect. I don't know, maybe he's having a network problem. So let me open the floor now for questions. You can unmute your mic, and if you have any question, you can ask. I would forward the questions to the facilitator. Please, it's time for questions. It's time for questions. Let me know that we'll be following. It's time for questions or comments, or if you want to make a clarification of something. No one has any question?
Okay, good afternoon, everyone.
Okay, good afternoon.
Mine is a question on the industrial aspect.
Please, can you just introduce yourself, if you don't mind?
Okay, okay.
Your name and state of practice.
Okay, my name is Abdullahi Al-Bakar Sadiq. I am currently practicing at Kaduna State.
Okay, thank you.
Okay, my question is in the industrial aspect, there's been this concern that the Nigeria's industrial space is still very much crude. Like we're still doing the things of the 20th century in the developed world. You said?
I thought they said it's inside Canada.
Okay. That we're still doing the things of the 18th century of the developed world. With this type of systems, would he still advise young pharmacists to start a career in the industry in Nigeria?
Okay. Okay. So that's the question. Let me see. Well,
Yes, I don't know what happened.
okay, our
can you enable,
facilitator is back.
yeah, can you enable the share screening so that I can share my screen?
Okay, I think you joined with my link. Let me see if I can enable share screen for you. I think you can do that now.
Yes, thank you.
Welcome.
Yes, here. Sorry for the intro. I don't know what happened with the connection. Was it my own or what? So I'm talking about the pharmacist's role in intergovernmental organization, where I
Sorry,
was.
sir.
Yeah, can you hear me?
Yes, we can hear you. And there was a question before you, when you left, we started the session for question and answer. So when you're done, he would ask the question.
Yeah, we entertain questions at the end. Yes, sure.
Yes, sir. Thank you.
Yeah. So for instance, the FIP and the WHO has been working together. And why I'm saying this is because pharmacists are actively engaged in that. For instance, the FIP give a lot of official presentation, and they invite, the WHO invite FIP at all of its governing body meetings. For instance, the World Health Assembly and the WHO Executive Board's meet. The FIP provide expertise in the WHO Expert Committee on specification for pharmaceutical preparation to review guidelines on quality assurance, which is adopted as international standard. For instance, in 2019, in Geneva, during the World Health Assembly, the FIP organized a high-level dinner with the WHO where we have some delegates from across the globe practicing in different areas of medical profession. This is essentially organized by FIP, and the essence is to address the 18 million shortfall of healthcare workforce, which has been forecasted to happen in 2030. So you can see how interlinked some of these careers are between partnership and practicing in a particular area. When you are talking about non-governmental organizations, what do pharmacists do in non-governmental organizations? This is also an evolving area in the practice setting, especially in developing countries. Because if you look back to like say 40 years, 30, 40 years ago, these are not really existent, or even if they exist, very, very minute scale. But nowadays, pharmacists are actively engaged in non-governmental organizations, especially health promoting non-governmental organizations. They serve as consultants, experts in drug supply chain logistics. They do serve as supply chain risk analysts, supply chain auditors. They can also, or they serve also as fieldwork or data collectors. And in most cases, you will see that you need some competencies in order to meet off your role in these specific areas. For instance, you need some advanced courses in drug procurement and supply chain management. You need some advanced courses in health economics, health financing, because that is how you understand what these NGOs are doing and what actually competencies they need. If you meet up those competencies, then you can be able to work efficiently and serve your responsibility within the non-governmental organization as a pharmacist. Pharmacists can also have some roles within professional organizations, such as the FIP. We all know FIP, and briefly to tell us, we might be aware, but FIP was founded in 1912. It is a non-governmental organization with its head office in Hague, the Netherlands. It is a global body representing over 144 national organizations and over 4 million pharmacists, pharmaceutical scientists, and pharmaceutical educators worldwide. And essentially, the work of FIP is to improve global health by supporting advancements in terms of innovation in pharmaceutical practice, innovation in pharmaceutical sciences, and innovation in pharmaceutical education. When we talk about innovation, it's not only in one aspect of pharmacy practice or in pharmacy career practice, but in all aspects of ramification. Science, practice, and education. That's to say one FIP, if I may use this as the FIP president used to say. Do pharmacists serve some role there? Yes, they serve roles. I'm not talking about voluntary work or voluntary services to the FIP as an organization. I'm talking about real job as a career. For instance, we have pharmacists that are serving as lead for education policy and implementation within FIP. They have a structured salary and a structure as employers, as employee there. We have also pharmacists serving as lead for workforce transformation and development. We do have pharmacists working in FIP leading for policy, serving as lead for policy, practice, and compliance. So all these are pharmacists, but they do have some competencies, of course. What are some of these competencies? These competencies you need to serve there include some advanced degrees like PhD, masters, or some advanced courses on strategic management, international relations, and so on. What are the prospects of pharmacy practice, for instance, in Nigeria? There are several prospects that are ever increasing. For instance, when you're talking about non-governmental organizations dealing with HIV, malaria, and TB logistics, a lot of pharmacists are working there, and still they will continue to work because I believe the role will continue to emerge. So you must be able to adapt and acquire the necessary skills so that you can fit in. We are talking about vaccination and immunization logistics as well as administration. Why I underline this red administration of vaccine is because pharmacists, especially in the context of our country, for instance, they are lagging behind. Yes, they need to advocate so that the government will understand their relevance and their competence in that serving in that aspect. They also need to develop the necessary competence. This will all help in eradicating or reducing vaccine hesitancy because pharmacists are the most closest to the community in terms of other healthcare professionals. There is also ever increasing number of pharmacy schools in the country, for instance, in Nigeria. What does this mean? It simply means there will be an ever increasing flow of pharmaceutical workforce. But what about the quality? What about their quality, the graduates? Now it is up to you, serving or practicing in the academia, to develop yourself, to develop the necessary competencies and skills so that you can produce the competent pharmacists in the future that can serve not only the purpose of pharmaceutical needs in the country, but also the pharmaceutical needs across the globe. They can practice not only in Nigeria, they should be able to practice outside Nigeria. And it is only by giving them the necessary and competent knowledge that they can be able to compete with their other counterparts across the globe. So in conclusion, or I may call it recommendation, career in pharmacy continue to evolve in the sense that there is ever increasing demand by the society on pharmaceutical needs. So therefore the pharmacists must evolve along with these demands, with innovations, technological advancement, so as to meet the ever increasing societal needs of their services. And to make ourselves relevant as pharmacists, we must adapt and grow with this advancement in all aspects of ramification. Here I'm talking about the pharmacy education, science, and practice. So depending on the area of specialty you have taken or you consider as a career, you must develop yourself with time and over time. You should never stop learning. You must be able to improve yourself from time to time so as to be relevant in the global sphere of pharmacy profession or pharmacy practice. And you must as well be able to practice anywhere in the globe, not only within your own comfort zone. You must avoid silo. You must avoid working alone. You must work collaboratively, develop your network, ask questions, and seek knowledge. So finally, I have some useful resources for the young pharmacists to improve ourselves. Some of us might be familiar. If you are not, you can take some courses on procurement and supply chain management, depending on the area you want to improve yourself. There are some courses I implore you to check the website of this, for instance, the United Nations Development Program, UNDP, the JSI Research and Training Institute. There is a website there. Check their courses on procurement and supply chain management. Even if those of the basic one, try and enroll and have them added on your CV. There is a Global Health e-learning center. Try and visit the website. There are a lot of courses there that could be relevant to you, depending on the career area you are interested in. Some of them might be very, very relevant to you. There are also courses on e-learning, a Coursera e-learning platform, where you have so many courses electronically. You can enroll and you can even apply for scholarships as pharmacists from developing country. I'm sure you can apply for some certain scholarship and they can be able to offer you. I will also implore you to visit the United Nations Volunteers website so as to be able to register yourself for volunteer works. You have so many opportunities that can be very relevant for you in the future. And I thank you. Now we can take some questions. Once again, sorry for the interruption. I don't know what happened really. It's a technical problem, but I have no idea the main reason. Thank you and thank you.
Okay, thank you so much, sir, for that wonderful presentation. Thank you for enlightening us. Noura Abdullah, I've seen your hand. Abubakar Sadiq asked a question earlier, so let's start with him before we come to Noura Abdullah Ahmad.
Okay.
Abubakar Sadiq, you're on now.
Okay, thank you very much, sir. Once more, my name is Abdullahi Abubakar Sadiq, calling from Kaduna State. So I was asking, we seem to have a crude industrial system here in Nigeria, and it could be very discouraging thinking about starting a career in a place that is still operating in the 18th century as compared to a developing nation. What's your advice to young pharmacists on how to navigate within the industrial space in the light of these
Challenges.
issues? Yes, and challenges.
Well, thank you. Yes, that's the question, right? Are you done?
Yeah. Yes, that's my question.
Oh, okay, thank you for the question. Yes, you are right. I think what I will advise is that the pharmacists, especially the young pharmacists aspiring for industrial practice, they should not limit their thinking of practicing only in Nigeria, for instance. That is one. Two, even in the Nigerian atmosphere, at the present, I heard about the current DG of the NAFDAC making so much efforts towards ensuring that our local pharmaceutical manufacturing industry actually are complying with the international standard. There is this issue of HVAC, the air circulation and ventilation system, where before you see even pharmaceutical industry manufacturing internal preparations, they just located anywhere, anyhow. There is no regulation for the airflow in their system, but now HVAC, because it is a very critical aspect in pharmaceutical manufacturing, especially for internal preparations. So it is making that it is now a rule or a mandate that every pharmaceutical industry or certain manufacturing internal preparation must comply with that HVAC, which I know is costly, but it's important. So therefore, some advances or some changes are happening toward that direction, and they are trying to improve the quality of production. So pharmacists can still look up with respect to that. Changes are coming, and they can even be the agent of change in that regard. And at the same time, they can also explore other options. There are multiple websites for pharmaceutical industry seeking for pharmacists on a global level, not only their own. You can have pharmaceutical industry in Geneva, in Italy, for instance, in Australia. They will be seeking for, so depending on your competency, if you have the sufficient competencies that they need, you can submit your application. Most of the applications are online. You submit your application, and as long as you meet their requirements, I believe they can engage you, they can contact you, and they can employ you. So you should think in a double way. One, on the local level, how can you get there, and how can you be an agent of change? And then on the other parts, you should not restrict your career thoughts or your career aspiration within Nigeria only. I hope I answer your question.
Yes, sir.
Abubakar,
Thank you.
okay.
Yeah, sorry, my mic was muted. Yes, sir. Thank you very, very much.
It's okay. You're welcome.
Thank you for that question. Next, we move to Noura Abdullahi Ahmad. From him, then, and after him, then Abba Ahmad Ado. Okay, go on. Good afternoon.
Yes, afternoon, Noura.
All right, thank you, Pharmacist Olubukola Jumbo, the organizer of this program, together with the Northwest Zonal Coordinator. Northeast, I mean, I'm used to a Northwest, sorry.
It's okay.
Coordinator for organizing this program, and also not forgetting our national chair, who is pharmacist, also pharmacist Yimika Ogus, for organizing this webinar. Actually, mine is just a testimony and also a congratulatory message also, because this is an avenue for me to also congratulate the facilitator for this wonderful webinar, and also for the grab of his PhD program. Actually, congratulations.
Thank you.
The testimony I have for him, Pharmacist Khalid Garb Mohammed happens to be my mentor. Actually, he has been navigating my career since, right, even from pharmacy. I have students since from pharmacies, before pharmacies. So he's the one that is even encouraging me to study pharmacy and also to attend Ahmad Bello University's area. So he's my, actually, since before pharmacy school. So he has been navigating the trends since before pharmacy school for us. So that's why I also congratulate Northeast Zone for having him as a facilitator today, because there is no any other right person to handle this topic, to the best of my knowledge, than Pharmacist Khalid Garba. So congratulations. And all what he has said, actually, I have noted down and I'm going to practice it as it is. My advice here to young pharmacists is we should not procrastinate actually every day. We should start something doing. Despite the challenges that we have in Nigeria, at least that professional collaboration, especially with international organizations, is very, very key. If you have something that you want to improve on, and there's challenges in Nigeria, as he said, not necessarily for you to practice in Nigeria, you can look outside to see who is going to offer help to achieve that. So actually, this is a nice webinar, and I have learned a lot. And we can see.
Thank you.
About mentorship and mentee relationship. Thank you very much.
So much. Thank you, Nura, and thank you. Continue to be a good ambassador. Yes, next question.
So the next person is Abba Ahmad Ado. After him, we'll take one or two more, then we'll be done.
Okay.
Abba Ahmad Ado.
Hello, and
yes,
good
Abba,
afternoon.
I can hear you. Good afternoon. Go ahead.
Yes. So I feel very sad, like I'm joining this at the late hours. Towards the
well, you should feel happy. At least you join, even if it is for 5 minutes.
Yes, of course. But the little I've heard from the FIP partnership and other things, we are so much thankful for the lecture, and we wish like you organize more of these things to sensitize us, because some of us like that are just freshly graduating from university are having difficulty in choosing a career. Really is giving us a very big headache.
Yeah, I can imagine.
Yes, so thank you so much, sir. And I would like to ask a question on this NGO and the role of pharmaceutics. You know, specialty in pharmaceutics with NGOs. Yeah. Please, if there is any clarification, thank you.
Okay. A very nice question, actually. Yes, dealing with the role of pharmaceutics in NGO, I wouldn't say much, but I consider you as a pharmacist, not as a pharmaceutics, because pharmaceutics is an advanced degree where you specialize in a particular area. So having a degree or additional qualification in pharmaceutics is not really necessity for you if you want to play work in the NGO. You can develop your skills and yourself in some aspects that are so peculiar to the NGOs. As I mentioned, most of the world non-governmental organizations, especially health-related non-governmental organizations, you're talking about, for instance, Clinton Health Access Initiative. I'm talking about where I have experience, for instance, PricewaterhouseCoopers, PwC, for instance. In most cases, your competencies that you need is the key competency you have as a pharmacist. For instance, you are going to serve as a data collector. You are going to serve as a facilitator, probably to train some maybe clinicians on some specific treatment regimen. These are your core value as a pharmacist. It's not as a formulation scientist, for instance.
Yes, sir.
So you can develop your, in addition to your maybe competencies in pharmaceutics, if you have interest in pharmaceutics, you can also engage dealing with NGO by developing some competencies, some advanced courses in logistics, drug procurement, for instance, so you can have a kind of a dual advantage.
Yes,
At the same time, if you're talking about specialty in pharmaceutics and other aspects, not necessarily in the academia, yes, for instance, you can have advanced knowledge in pharmaceutics, but at the same time work with WHO, depending on the department where you are going to serve or where you are going to work, or a team, a committee. So all this depend on yourself, how you want yourself, how you want to improve yourself, and so on. I hope I answer your question.
Yes, sir. Yeah, an oasis in the desert, and thank you so much, sir.
Yeah.
Okay, thank you
And
so much.
Murma, I don't know. I see the chat box. I don't know. Are there questions there in the chat box or what?
Yes, there is a question, not a question per se. There is, someone is asking for some of the links you dropped.
Yes.
If you can share it. Then someone is asking if the webinar is available for download.
This will depend on you, the organizers. I can handle the slides to you, and then you can decide as you wish.
All right, no problem. Maybe I'll get the slide and share it on our groups.
Yeah, I will share the slide with you.
All right,
later.
thank you so much, sir. Then the last person, Sani Abdullah Suleiman, you're up now.
Hello.
Yes, Malan Sani, Pharmacist Sani, you're welcome. Go ahead.
Good evening, good afternoon, organizers and facilitators.
Yes, we can hear you.
I'm from panel. Yes, when I see the topic was so enlightening and eye-catching. But what I realized that with this webinar is not this how you have done well, but all I can emphasize in we have like short notice, and there's poor publicity because people have been asking link from me to send a link. So I'm urging you all, when you have such a great mentor that is coming before us, so we need to have like 1, 2, 3 days of publicity that this one is coming, because I realize even if we are organizing this per state, not the whole Northeast, that we can have the appreciable number. But by the way, the littles we have come online, we have learned a lot. So it's either sending the complaint through the Northeast or through the Northwest, because I realize all of you are online. Make it to be part of maybe what we will be having as a webinar later in the day, that you organize in such a way that we can have more number of pharmacies that will be online, and we can have such interesting interactions, because we actually learn a lot. That's why we are liking. You can finish pharmacy schools, you think that's all, you are now a pharmacist. So then after being pharmacist, what next? That's when someone will spend 5 years after graduations, they don't even have focus because we lack this mentor-mentee relationship. But with what I have Northwest coordinator said earlier, Pam Khalid, as what we call doctors. Me, I prefer to say Pam, then I say doctor in bracket. He has been my mentor right from pharmacy school. So we thank you all. We really appreciate. Now my question is that, as a pharmacist in academia, what are you doing to try to see the academic pharmacies has now, like, they are conforming with the world's standard of practice? Because what I realized, all we have been taught in schools, when we come out in practice, we realize the things are different. We have been taught about how to rub powder in dispensing, or how to do all these things. But when you come to the practice in larger scale, you realize the things is different. Thank you very much. Have a wonderful day.
Yeah, thank you, Sani, for your own side of the webinar. I think as academic, as I mentioned some of the key competencies that you need. You don't work in silo. That is the key message. You collaborate. You talk to others. You attend conferences. You attend workshops. You improve yourself. Because as far as academia is concerned, yes, advanced degrees are mandatory for your promotion, master's, PhD, and so on. But the other competencies that you need to acquire, for instance, how to teach online, how to communicate effectively with your student, how to engage them, how to understand them emotionally, how to have effective interaction between teacher and student. It's not only about teaching them academics sometimes, it's about understanding some of their, not completely, but just some hint of their personal problem. You sometimes might see student, you know him, how he used to probably present physically, and you see him one day appearing different. So common sense should enable you to try and check on that student. So some of the competencies are actually based on you. If you work on silo, you may not acquire them, but you engage, you involve. For instance, this FIP, it has been working in so many ways to develop some competency frameworks, even for the academics pharmacists. But if you are not member of the FIP, if you are not getting there, if you are not busy or seriously engaging, how are you going to know about those competency skills? How are you going to know? You will not. So you have to engage yourself. You have to develop yourself. And at some point in time, you have to sacrifice for yourself. For instance, you may have a situation whereby you have a program to attend, but your institution, especially if you are practicing in the developing country, is not willing to sponsor you. So if you have the finances enough, you can sponsor yourself. I cannot count the number of times where I held myself responsible. I sponsor myself for so many programs. All I know is for myself and for the system to improve myself. I attended conference on personal basis. So yes, there is gap between practice and knowledge you acquire and the practice, especially in the developing countries. There is an analysis I think we have done for FIP recently, where we identify some gaps in terms of practice. The knowledge that pharmacists acquire in the school and what they actually practice, there is this disparity. So the academic pharmacists, especially in developing countries, must be able to actually evolve so as to change that curriculum. There is a curriculum system review. The FIP through FIP UNESCO Unity program is pioneering some of this program. We have a FIP Center for Excellence in Africa. I am part of it. So what we are trying is to harmonize and see what are these gaps and how do we bridge these gaps. So FIP is bringing about pharmacists, professors from developed countries, from US, from UK, from Europe, so as to harmonize ideas and issues with the pharmacists in the academia in the developing countries on how to bridge some of these gaps. So by so doing, and it's only by the pharmacists that are in the developing country making themselves relevant and available for such program. That's only you will have an efficient transition and evolvement of the pharmacy practice to meet the actual need outside the pharmacy school. Thank you. I hope I answered your question. Murma, I think it's time. I see one person sent a message. I don't know. It looks like a general or private message. The person is Abakar Sadiq Abdullahi. Is asking about pursuing a career or master's in pharmaceutics because you want to work in the pharmaceutical industry. Yes, you can do that within or outside. I don't know if the person is there. You can check my email, or you can send me a private message whenever you are ready. So Murma, are we ready, or do we have additional question?
No, we don't have any other question. Please, I have dropped on the chat box. I've dropped a Google survey form. Just 15 seconds. You can just fill it and tell us what you feel about this webinar or any other thing. Thank you so much, Dr. Khalid Garba, for having us here. It was really
thank you all.
Yeah,
thank you all. I'm glad to see most of you. Long time actually. Thank you, and take care, all of you. Bye bye.
Well. Thank you so much. We were grateful till we come again for some other things.
Anytime. You're welcome.
Thank you, sir. All right. Now, thank you all for joining. Bye bye.
Bye bye.